Okay, let's talk about renal blood circulation. This is going to require that we look at two different slides because the large blood vessels are visible when we look at the gross anatomy, but we need to look at the microanatomy to see how the micro vessels connect with the nephrons. So we'll start with the gross or the large anatomy. Bringing blood into the kidney is the renal artery. The renal artery, when it reaches the kidney, branches into what are called segmental arteries. These segmental arteries then branch again, and they go on either side of the lobes. So you can see that they're going between the lobes. These are called interlobar. Inter meaning between, lobar meaning lobes. So we have the interlobar arteries. The interlobar arteries reach the end of the medulla or the top of the renal pyramid, and they curve to go along the top of the renal pyramid. As they curve, they make an arc because the renal pyramid is rounded. And so these are called arcuate arteries. The arcuate arteries then branch again and send smaller vessels, small arteries, into the cortex. These are called interlobular arteries. So almost the same name as the interlobar arteries, but it has the extra syllable ule in it, interlobular. Now, there are other vessels in here that we're going to talk about on the next slide. But for now, I want you to imagine that the blood is passing through those and now is returning to leave the kidney through the veins. And the veins are named exactly the same way as the arteries are. So the blood returns through interlobular veins, arcuate veins, interlobar veins, segmental veins, and then into the renal vein. Now let's take a look at the microanatomy. Okay, so I mentioned, or if we look at a lobe here, we've got the interlobar arteries and the arcuate arteries, and then the interlobular arteries. I want to find those same vessels on this diagram, which does show the microcirculation. So here we have the arcuate artery. You can see that it's curved. So down here, even though it's not been drawn in this image, is the renal medulla, the renal pyramid. The blood comes through the arcuate artery, goes into the interlobular arteries, and then it branches into what's known as the afferent or the afferent arteriole. This arteriole carries blood to the glomerulus, where it is filtered. Any blood or any substance that doesn't leave the glomerulus and go into the glomerular capsule and into the nephron, if it stays within the vessel, then it leaves the glomerulus through the efferent or efferent arteriole. Now, in this circulation, the efferent arteriole then branches into a second capillary bed. These are known as peritubular capillaries. Peri, P-E-R-I, means surrounding. Tubular refers to the tubule here. And so these are peritubular capillaries, capillaries that surround the main tubules of the nephron. After the blood passes through the peritubular capillaries, it enters an interlobular vein, an arcuate vein, and then is on its way back out of the kidney. If we look at the circulation around the other nephron, the juxtamedullary nephron, we still travel through the arcuate artery into an interlobular artery, and it still branches off into an afferent arteriole, which then carries blood to the glomerulus. The blood cells that don't leave the glomerulus and go into the nephron then go to an efferent arteriole and pass into the medulla into this parallel arrangement of capillaries known as the vasa recta. Vasa means vessels, recta means straight. So these are straight, not random curlicue capillaries. So the blood passes into the vasa recta, comes back out of the vasa recta into the arcuate vein and out of the kidney through the vessels that we talked about before.